Welcome to the introduction to veterinary pharmacology. This presentation will talk about the important terms that are related to pharmacology, the divisions of pharmacology, the categories of pharmacology, a comparison between medical and veterinary pharmacology, and the basic concepts that are related to drugs. Pharmacology is defined as the experimental science or study of drugs and their interactions with living systems. It is derived from the Greek word pharmakon, which means drug, and Latin logos, meaning study. Generally, a drug is defined as any chemical substance affecting living organisms. In pharmacology, a drug is specifically defined as a chemical substance used in the treatment, cure, prevention, or diagnosis of disease, or used to otherwise enhance physical or mental well-being. In federal law, it is defined as any substance recognized in the official pharmacopoeia or formulary of the nation. So when we say pharmacopoeia, that is a book containing a list of medicinal drugs with their effects and directions for use. It is also defined under the federal law as any article, other than food, intended to affect the structure or any function of the body of humans or other animals. Drugs also include a habit-forming medicinal or illicit substance, especially a narcotic. A narcotic is a drug or other substance that affects mood or behavior, especially one that is sold illegally. Another form of drug is the nutraceutical. This refers to nutrient substances used as drugs. The word nutraceutical comes from the term nutrition and pharmaceutics. It is applied to products that are isolated from herbal products, dietary supplements, specific diets, and processed foods that, other than nutrition, are also used as medicine. So examples of nutraceuticals are minerals such as calcium. We also have vitamins such as beta-carotene, lycopene and thiamine, and substances such as chondroitin sulfate and glucosamine. So nutraceuticals generally are derived from plant, animal, and mineral source. So examples of nutraceuticals that are derived from plants are the vitamins, such as the beta-carotene, lycopene, as well as thiamine. For the nutraceuticals that are derived from both from animals as well as in men, this includes the chondroitin sulfate and the glucosamine, which are abundant in joints. We also have the nutraceuticals from mineral sources, and that includes calcium. The fibers are also included in the definition. When we are going to differentiate a nutraceutical from a drug or a pharmaceutical, so usually in the healthcare, the pharmaceutical is from a synthetic source, whereas the nutraceutical are again derived from either a plant source, an animal source, or mineral source. Moving on to the divisions of pharmacology, so we have 4 general divisions of pharmacology. We start with the pharmacokinetics and pharmacodynamics. So usually they are in tandem. We also have the pharmacotherapeutics, toxicology, and pharmacy. So when we say pharmacokinetics, that will answer the question, what the body does to the drug. Pharmacodynamics, on the other hand, will answer the question, what the drug does to the body. When we say pharmacotherapeutics, that is the study of the use of drugs. And when we say pharmacy, that refers to the process of preparing suitable dosage form. Of course, when we say toxicology, that refers to the study of poisons. So starting with the pharmacodynamics or PD, it is the study of the action and fate of drugs in the body. So when we say fate of drugs in the body, that refers to the outcome or the destination of drugs in the body, how the drugs produce their effects on living organisms or the response of the organism. It will answer the question what the drug does to the body or the power of drugs on the body. So meanwhile, when we say pharmacokinetics or PK, that is from the Greek word kinetikos, meaning moving. It is during the time after the drug has been administered up to its elimination or excretion from the body. It will answer the question what the body does to the drug. This diagram shows the two phases of drug action involving the pharmacokinetics and the pharmacodynamics. So our starting point here is the drug or the dose administered. The pharmacokinetic phase is concerned with the relationship between the value of the dose administered and the value of the drug concentration that is achieved in the body. The pharmacodynamic phase is concerned with the relationship between the drug concentration at the site of action and the onset, intensity, and the duration of the drug response. So another division of pharmacology is toxicology. So it is the study of the harmful effects of drugs and the conditions under which these harmful effects occur. It is concerned with the study of symptoms, diagnosis and treatment of poisonings, and identification of poisons. It also deals with the adverse effects of xenobiotics. So a xenobiotic is a term used to describe chemical substances that are foreign to animal life, and it may include plants, plant constituents, drugs, pesticides, cosmetics, and others. We also have pharmacotherapeutics or simply therapeutics, and this is a division of pharmacology concerned with the useful application of drugs in the diagnosis, prevention, and treatment of diseases, and in the purposeful alteration of normal body functions. So when we say diagnosis, that refers to the act or the process of identifying a disease from its signs and symptoms. So before we are going to apply a particular drug for a particular type of disease, we first have to identify what specific type of disease is present in that particular individual and what particular pathogen, if it is an infectious disease, might have caused that particular illness or disease. So examples of pharmacotherapeutics include the induction of anesthesia. So an anesthetic is a drug that can be applied in order to induce anesthesia. And we also have the use of drug in order to time or to synchronize estrus. So that is also an example of pharmacotherapeutics because it will alter the normal body functions of the animal. So in therapeutics, we have different modalities that are being used in order to treat a particular disease, in order to diagnose, to prevent, or to alter a specific type of physiological function of the animal. And this include the use of the drugs, surgery, radiation, behavioral modification, and other modalities. So another division of pharmacology is pharmacy. It is the art and science of collecting, developing, preparing, compounding, standardizing, and dispensing drugs. So basically, when we say dispensing, that is the process of preparing medicines and distributing them to users with provision of an appropriate information, counseling, and follow-up. So good dispensing practice ensures that the right medicines at desired quantity are delivered to the right patient with the right dose, strength, frequency, dosage form, together with clear instructions, with appropriate packaging and counseling. So under pharmacy, we have some important terms that we need to know For example, we have the pharmacognosy, and this refers to the study of sources of drugs. We also have posology, that is the study of the drug dosage. And it is said that the drug dosage varies with the species of the animal. So of course, there are certain species of animal that are, for example, that are bigger compared to other animals. So the bigger animals require a larger drug dose compared to smaller animals. We also have the intended effect of the drug. So for example, when a particular drug is intended to produce a therapeutic effect versus a drug that is intended to produce an effect that is below the therapeutic response. So of course, the dose of the drug will vary. Another is the individual tolerance or the susceptibility. So there are certain species of animal that are more tolerant to that particular drug compared to the other species of animal. And we also have some animals which are more susceptible or sensitive to a particular drug compared to other species of animal. So, for example, now those animals that are more sensitive to a particular drug, so they require um, a lower dose compared to those animals that are tolerant to that particular drug. So when we say, so under the posology, we have the terminologies dose and dosage. So when we say dose, that is the quantity or the amount of drug or medication to be administered at one time. When we say dosage, that refers to the determination and the regulation of doses. So for dosage, this already includes the time frequency that a particular medication will be administered. We also have the effective dose of the drug. So this is the amount of drug that is necessary to produce the desired therapeutic response in the patient. So for example, in dogs and cats, the typical dose of amoxicillin ranges from 5 to 12 milligrams. So the 5 to 12 milligram is considered to be the dose of amoxicillin for dogs and cats. So again, the dose of the drug is the quantity of the drug that is administered at one time. As for example, in the case of paracetamol, it has a dose of 500 milligrams. For the dosage, that is the amount of the drug that should be given over time. So for example, 500 milligram paracetamol 3 times a day for 3 days. So here an example of the dosage of amoxicillin. So again, the dosage includes the determination of the dose of a particular drug, and it has the element of time and frequency. So in this particular label or prescription, so it says here for how frequent and how long will the drug amoxicillin will be administered. So we also have here a comparison between the job of a pharmacologist versus a pharmacist. For pharmacologists, they are the professionals that are in charge with the development of new drugs and study the effects of these new drugs so that they are both effective and safe for use. Meanwhile, the pharmacists fill the prescriptions, verify the accurate drug and the amount that is being dispensed, and then counsel patients on the use of the particular medication. We also have the different categories of pharmacology. So veterinary pharmacology is concerned with the drugs as they are used in the diagnosis and treatment of animal diseases and in the intentional alteration of animal physiology. So the main focus or the goal of veterinary pharmacology is to provide a rational basis for the use of drugs in a clinical setting in different animal species. So when we say rational basis for the use of drugs, the veterinary pharmacology involves the use of drugs in a reasonable manner, meaning that we use drugs in a manner that is reasonable, meaning that we have a specific purpose in mind and we have the particular appropriate indication, appropriate goal in order to treat a particular disease. So we don't just prescribe a particular drug, but we first need to properly diagnose a particular disease before we are going to provide uh, or prescribe a particular treatment regime or medication to that particular animal. So when we say clinical pharmacology, that is concerned with the rational development, effective use, and the proper evaluation of drugs for the diagnosis, prevention, and cure of diseases. So in clinical pharmacology, we do actual observation and treatment of patients. So controlled evaluation of the efficacy and safety of drug therapy in animal patients, or simply, it is the safe use of drugs in any animal species. We also have here a comparison between basic and clinical pharmacology. So the distinction being whether studies are conducted in healthy or diseased animals, studying experimental models or natural disease states, or involve laboratory or clinical studies in actual veterinary clinical situation. So therefore, when we say basic pharmacology, we usually deal with healthy animals, clinical pharmacology, diseased animals. For basic pharmacology, we usually deal with experimental models, while for clinical pharmacology, that is, we deal with natural diseases. So we also have chemotherapy. So we define chemotherapy as a branch of pharmacology dealing with drugs that selectively inhibit or destroy specific agents of diseases such as bacteria, viruses, fungi, and other parasites. So it is also defined as the use of drugs in the treatment of neoplastic or cancer diseases. So we have here an important phrase, selectively inhibit or destroy specific agents. So meaning that under chemotherapy, we use a specific type of agent that will selectively inhibit or destroy, for example, bacteria, selectively inhibit or destroy viruses, fungi, and other types of parasites. So for example, for bacteria, we use antimicrobial or antibacterial agents, and these are only specific for bacterial pathogens or bacterial agents. For viruses, we also use antiviral agents. For fungi, we use antifungal agents. And for parasites, of course, we use antiparasitic agents. For diseases that are cancerous in nature, of course, we use the anti-neoplastic drugs. So the bottom line here is that the antimicrobial agents will only selectively inhibit or destroy bacterial agents. And the same is true for other chemotherapeutic agents. So we also have pharmacogenomics. So the pharmacogenomics is the study of the genetic variation in drug response. It is the study of the genetic variations that cause differences in drug response among individuals or populations. It is also the study of the genetic determinants of response to drug therapy. So for example, there are certain animal species or certain animal population which are, for example, they are more susceptible to a particular drug, they are more tolerant to a particular drug, and this study is under the field of pharmacogenomics. So we also have here a comparison between veterinary and medical pharmacology. So in terms of the nature of the profession, veterinary deals with animals. For medical pharmacology is in humans. For the scope, of course, the veterinary pharmacology has a wider scope because it involves different animal species. So under this, now we have the importance of comparative pharmacology and the pharmacogenetics or the pharmacogenomics, now which involves the individual variation in the response of the animal to a particular drug, no, as dictated, no, by the genome or the genetics of that particular animal. We also have the in terms of the method when we are going to compare them, so both can apply both individualized or herd or flock approach, in terms of the treatment, for example. For the roles, of course, the veterinary pharmacology is geared towards the treatment of animals, while for the medical pharmacology um, deals with the protection of man. But they can also be both, no, because there are certain instances wherein the role of the veterinarians will also protect man, and the role of the medical in the medical field will also protect the animal field, because there are certain diseases that can be transmitted, between um, uh, animals to man and man to animals. So as a final statement, the veterinarian must keep in mind that there is no completely safe drug unless the compound is pharmacologically inert or chemically inactive. So thus the art of rational therapeutics requires consideration of potential risks as well as the possible benefits of drugs to the patient's well-being. So an important consideration when we are going to apply drugs, or we are going to use drugs in therapeutics, is that the benefits must always outweigh the risks. The veterinarian must therefore understand the actions of the drug on the body, so that is the pharmacodynamics of the drug, how the drug is absorbed and eliminated in the body, so that is the pharmacokinetics of the drug, its toxic effects, so that is under the field of toxicology, its clinical indications or the pharmacotherapeutics of the drug, its clinical uses, as well as its dosage, in the species of animal to be treated.